Today we're diving into how medical professionals act a whole lot like detectives, using nothing but their eyes to uncover the hidden stories a child's body tells. We usually think of modern medicine as just an endless parade of blood tests and high-tech scans, right? But honestly, before a single machine is ever turned on, a massive wealth of critical information is sitting right there in the exam room. Today we're going to explore the sheer power of diagnostic inspection in pediatrics. We'll decode facial dysmorphism, investigate skin lesions, spot muscle asymmetry, and identify skeletal deformities, literally just by looking closely.
Here's our head-to-toe roadmap. We'll be looking at 1. The art of visual diagnosis. 2. Facial and cranial clues. 3. Skin lesions. 4. Muscle and skeletal asymmetries. 5. Chest and torso abnormalities. And finally, 6. The complete head-to-toe sweep.
All right, Section 1, the art of visual diagnosis. We're starting right at the top, focusing on the very first impressions a child's general appearance can give us. This is where the detective work truly begins.
Now, what's really fascinating here is how just a quick glance at the shape of a face or the ears can immediately point us toward deep-rooted prenatal or genetic syndromes. When we talk about dysmorphism, we're combining dys, meaning abnormal, with morph, meaning shape. So we're on the hunt for very specific physical deviations. If you see epicanthal folds around the eyes, an increased intercanthal distance, a wider space between the eyes, or weird anomalies in the external ears, a red flag should immediately go up. These visual clues strongly suggest a prenatal disorder. It could be teratogenic, meaning caused by something environmental during pregnancy, or it could be entirely genetic. Sometimes these features literally combine to spell out a highly specific syndrome entirely through observation.
Moving on to Section 2, facial and cranial clues. Let's see how these first impressions build into really specific signs found right on the skull and eyes.
The huge takeaway here is that a seemingly tiny detail isn't just cosmetic, it's a profound clue about the nervous system. Let's look at the skull. If a child has dolichocephaly, an elongated head shape, that tells a story of early development, since it's super typical in preemies. But what if there's a bald spot right on the back of the skull? That tells us the child might not be moving their head normally. It's actually a direct sign of weak neck muscles and generalized weakness. And the eyes. Wow, they tell a story. If the whites of the eyes, the sclerae, look blue, boom! Classic sign of osteogenesis imperfecta, a bone disorder. See asymmetric facial features or uneven pupils? Start thinking about nerve issues like facial palsy or Horner's syndrome. And if you've got facial asymmetry combined with vertical strabismus, misaligned eyes, that exact combo develops in torticollis, a twisting of the neck. Finally, involuntary eye twitching or nystagmus isn't just a quirky habit. It's a major red flag for cerebellar or central nervous system disorders.
Section 3. Skin lesions tell a story. Moving down to the body's largest organ, the skin is practically a visible ledger for hidden systemic diseases. This perfectly illustrates how a simple rash can literally mean the difference between early intervention and severe neurological complications. Café au lait spots, those distinctly pigmented flat areas, are super striking and scream neurofibromatosis. Got a kid with ataxia where their coordination is off? Check the flexor surfaces of the elbows and knees. If you see telangiectasias, those tiny widened blood vessels, that totally completes the diagnostic picture. A malar rash across the face points straight to rheumatic disease. And an adenomatous gland-like rash paired with seizures, you're likely dealing with tuberous sclerosis. Then we have the spine. Hairy patches, dimples, or a tiny pilonidal cyst in the gluteal crease are huge warning signs for spina bifida occulta. We care so much about spotting these because sudden weakness in these kids could mean an infection is actively penetrating the spinal canal. Also, quick side note, for children with sensory deficits, you have to meticulously check their skin for pressure abrasions because they literally can't feel the pain to warn them it's happening.
We always have to ask ourselves, why is this abrasion here? On one hand, the skin adapts to function. Foot deformities shift weight distribution, creating calluses that map exactly to that weird posture. See calluses on the tops of the feet and knees, aka housemaid's knee? That just means you've got an older child whose preferred way of getting around is crawling. But on the flip side, what if you see multiple scars and bruises in totally different stages of healing? You've got to pause. Sure, it might indicate frequent clumsy falls, but crucially, it is a massive, flashing red flag for child abuse. The skin is keeping a record of physical trauma, and it's our job to read it right.
Let's jump into Section 4, muscle and skeletal asymmetries. Now we're looking at the very muscles and joints powering the child's movement.
It's wild how the exact same visual cue, massive muscle enlargement or hypertrophy, tells drastically different stories. Look at the calves. If those are hypertrophic, it's actually an early critical warning sign for Duchenne muscular dystrophy. The muscle looks robust and healthy, but it's totally deceptive. It's masking a severe disease. Conversely, look at the upper body. If the shoulder girdles and upper arms are huge, that's a whole different story. That is pure physical resilience. It shows us functional adaptation, meaning the kid is effectively using crutches or a wheelchair. The muscle got big because it's doing the heavy lifting to navigate the world. Spotting asymmetry is absolutely crucial. These subtle deformities are literally windows into prenatal weaknesses and blood flow issues. Chest muscle atrophy? You might be looking at an absent pectoralis or a super old nerve injury in the shoulder. What about joints? Congenital club feet aren't just isolated foot problems, they are massive indicators of prenatal muscle weakness, like from spina bifida. If you see these very specific, fusiform, spindle-shaped, dimpled joints, that's classic arthrogryposis. Meanwhile, myotonic dystrophy can give a kid this stiff, muscle-bound appearance. And if one limb is visibly enlarged and you can hear a bruit, that whooshing sound of blood, you are definitely looking at an arteriovenous shunt with increased blood flow.
Okay, so we've checked the skin and the muscles, which leads us to a pretty fascinating question. What can the rigid cage of our bones reveal about the nerves hidden inside? Bones seem static, but their alignment depends entirely on the muscles pulling them. Section 5. Chest and torso abnormalities. Let's move to the torso and see how the chest cavity visibly alters itself when muscles fail.
When high spinal cord dysfunction or a motor unit disease knocks out the intercostal muscles, the ribs just flare out. This creates what we call a bell-shaped chest. The bones literally fall into this shape simply because the muscles between the ribs aren't working to hold the structure together. It's such a perfect example of how an internal failure reshapes external anatomy. Also, if that thoracic cage looks asymmetric, that's your direct visual indicator for scoliosis.
Section 6. The complete head-to-toe sweep. Let's wrap this up. This 4-step visual sweep ensures you don't miss a single clue. Step 1. Start at the top. Inspect facial and cranial clues for genetic or neurological signs. Step 2. Scan the skin ledger for spots, rashes, or signs of trauma. Step 3. Analyze muscle and skeletal asymmetries to understand nerve dysfunction. Step 4. Check the chest and torso alignment for deep structural failures.